So my research is in not just virtual health applications in general, but the use of conversational agents, or some people call them avatars, so basically virtual health counselors. And the privacy issues aren't so different from any other kind of mediated communication channel to the healthcare system. But there are some particular things to worry about, which is when you personify the interface, you have the opportunity for building trust with patients. Normally that's a good thing, because it means that they pay more attention to the information that's given to them, they're more likely to adhere to the recommendations, they have better outcomes. But there's also the potential for misuse. There's been studies showing that if you personify an interface and people trust it more, that they're more likely to divulge personal sensitive information. So again, if you use that for good, that's a good thing, but there's a possibility for abuse as well. There are many limitations using avatars in healthcare. So in our research, we look at very focused domains. Exercise promotion, breastfeeding promotion, preconception care, where there are fairly routine counseling sessions that we can script out in detail and have validated by clinicians. So in those areas where we're not doing interpretation, we're not doing diagnosis, they offer the ability to provide access to healthcare for people who might not otherwise be able to get it, or at least more frequent access. There's the potential, though, for problems also. So there's several companies now that are claiming to provide virtual doctors that you can just talk to, and using unconstrained natural language input to health counseling systems, in my opinion, can be very dangerous, because it allows patients to ask questions that the system can't possibly handle. Out-of-band questions phrased using natural language phrases that the system is unable to recognize. And if it responds with information that is inappropriate, if the patient's asking about their medication taking, or should I go to the emergency room, that can actually be dangerous. So there are some limitations, some definite limitations that need to be. There can certainly be a connection. So you can see the avatar as sort of being the doctor's ability to sort of reach out and take care of the patient while they're at home, have a more frequent interaction with them, be event triggered. So if there's an adverse event, then the doctor is notified. But as it is today, even if you have a chronic condition, you only see your physician every 2 or 3 months. So this provides a more frequent form of interaction, and the physician can fine-tune what the avatar is telling the patient, as well as what the triggers are for having them come back in. As you know, there are lots of opportunities for social media, such as Patients Like Me. In medical care, there are, of course, then very, very significant privacy issues. So one of the applications that we've developed is preconception care, which is targeted at infant mortality and low infant birth weight, specifically for young African American women. And we were going to build in a social media component to this. But the individuals in this demographic, so we're talking to teen girls about things like domestic violence and contraception, and perhaps not things that they want out in public. So we had to be careful with it, sort of mediated channels, so we could properly anonymize any information that was shared.